Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Sexually transmitted infections, or we call it the STI. So, we start with the genital herpes. Genital herpes is caused by the herpes simplex virus, HSV, and that is 1 and 2. So, it appears as presence of the blisters. So, it appears as blisters and it is usually multiple. So, there is multiple that lead to the ulcer formation or breaking. So, it leads to the ulcer formation as well as on breaking. It leads to ulcer formation on the breaking, and it is considered very painful. So, it is very painful. Then we move on to the granuloma inguinale. So, granuloma inguinale or the donovenosis, and this is caused by the Klebsiella. This is granulomatosis. So formerly it is known as the Calimatobacterium granulomatosis. So formerly it is known as a Calimatobacterium granulomatosis. So it causes a beefy red genital ulcers. So it is presence of beefy red genital ulcers, and it may lead to bleed. So it bleeds on touch. So the ulcers, it is painless. So the ulcers, if you see, it is painless. Then looking at the lymphadenopathy, it is usually absent. The lymphadenopathy, it is usually absent, but the subcutaneous granulomas causes pseudobuboes. So there is the subcutaneous granulomas. So subcutaneous granulomas, it causes a pseudobuboes. Next is, there is microscopy of the Donovan bodies. So microscopy of the Donovan bodies with closed safety pin appearance. So there is closed safety pin appearance is present. Next, let's move on to the chancroid. So your chancroid is also the soft chancre. It is caused by the HT, that is a Haemophilus ducreaceae. Haemophilus ducreaceae. So what is very special about this? So it is causes the genital ulcers. So it causes the genital ulcers that are non-indurated. So it is non-indurated and with the undetermined edges, with the undetermined edges. Next is the ulcers are painful. It is painful. Ulcers are very painful. Then there is multiple kissing ulcers developed due to the auto-inoculation from the primary ulcers. So there is presence of multiple kissing ulcers. They develop the auto-inoculation. They develop auto-inoculation from the primary ulcer. Next, what is present? Next is, it usually causes tender unilateral. So it causes the tender. There is unilateral. The tender unilateral inguinal bodies. So tender unilateral inguinal bodies. So looking at the microscopy, what is present? There is school of fish. The school of fish as well as the railroad track appearance which is present. Then we move on to the syphilitic chancre. So here in syphilitic chancre or the hard chancre. So this is caused by the Treponema pallidum. So it is caused by the Treponema pallidum. So what are present here? So it presents as a small. So it is present as small. So it is present as a small. It is button-like. So it is small. It is button-like. Next is there is presence of the indurated ulcers. So it is small, button-like, and it is indurated ulcer. That is usually it is round or oval. It is round as well as it may be oval. So the thing to note is these ulcers, they are painless. We are talking about the syphilitic chancre. So it is painless and it causes painless lymphadenopathy. So it causes a painless lymphadenopathy. So upon microscopy, what do we see? Upon microscopy, there is presence of the spirochetes. There is presence of spirochetes which are seen, and this is seen in terms of the dark ground. So it is seen in terms of the dark ground illumination. Then let's move on to the lymphogranulum venerum. So here in lymphogranuloma venerum. So in lymphogranulum venerum, it is caused by the Chlamydia trachomatis. So it is caused by Chlamydia trachomatis, and it is usually present with the transient single shallow ulcer. So it is present with the shallow ulcer, transient single shallow. So it is present with transient single shallow ulcers, and it heals. If you look at the healing process, it heals rapidly. So the healing process is rapid and it usually goes unnoticed. So it is unnoticed. Then we look at the secondary stage. The secondary stage is present with the tender inguinal bulbs. So the tender inguinal bulbos. Then there is also something known as the groove sign. So what is this groove sign? This groove sign is seen when the lymph node above. So groove sign is when the lymph node above and below. So there is a lymph node which is present above and below the inguinal ligament. Above and below the inguinal ligament, they are enlarged, leading to the appearance of the groove. So they are enlarged and they show the appearance of the groove. Next, we will move on to the gonorrhea. So gonorrhea is caused by the Neisseria gonorrhea. So there is Neisseria gonorrhea. So it leads to the purulent inflammation. So there is presence of purulent inflammation and of the genital mucous membranes, and this is of the genital mucous membranes. Next is, it may present as urethritis. So it can present as the urethritis and also the cervicitis. So it can present as urethritis, cervicitis, then the epididymo-orchitis, or also the PIDs. PIDs mean the pelvic inflammatory disease. So the usual presentation will be the acute urethritis. So acute urethritis is present, and there is also complaints of the burning dysuria. So there is presence of the burning dysuria, and also the purulent discharge. To learn and grow daily like this, please do subscribe.